Alrighty, everyone. Since it is 2:01, we will get started on our next session. This one's gonna be the panelists of human of my bad of medical humanities. And to get started, medical humanities is an interdisciplinary approach to understanding the effects disease and illnesses can have on patients and our society. Our first guest speaker is going to be Dr. Lindy Davidson, and she's a faculty member and associate dean for curriculum instruction in the Judy Genshaft Honors College at USF. Dr. Ulluminair Salim is also a faculty member at USF Honors College, and she explores whose lives matters, whose bodies count, and who should be able to decide questions like these. Next, we have Professor Atsuko Sakai, who's a faculty member at USF's Honors College, and her research focuses on examining human behavior and interaction with design objects, architecture, and environment. Our second to last speaker is Dr. Holly Singh, who is a full-time instructor at the USF Honors College, primarily teaching behavioral and social science courses. Finally, we have Dr. Catherine Wilkins, who works as an instructor at the USF College as well, and she also directs the Medical Humanities curriculum at the Morsani College of Medicine at USF.
Hi, Ayub. Thanks for having us.
Yeah, of course. Thank you, guys.
Good afternoon.
Okay, so if you guys want, you guys could screen share if you guys have anything. If not, we can just get started with the questions. So, questions, I'm guessing?
Yeah, I think that's great.
All right. So basically, guys, this is going to be a little panel. I'll be asking questions, and then each of them will be able to give their responses. And then towards the end, we'll be able to give Q&A if anyone has any further questions. So for the first one, it's going to be, what does medical humanities mean, and why should we care about the medical humanities?
Well, hi, I'm Catherine, and thanks for having us here today. I guess I'll get us started on, I think, what is going to be a rich conversation about the medical humanities. I'm sure we all have our own definitions. For me, the existence of medical humanities as a field is a recognition that the siloing that happens in academia is not representative of reality, that our bodies don't exist in isolation from culture, history, the environment, spirituality, though many of us are professionally trained as if they do. So medical humanities kind of takes the full range of tools, the methodologies and the bodies of knowledge that we have in our various disciplinary toolkits and brings these to bear on the universal human experiences of health and healing, suffering and illness.
Yes, I absolutely agree that, our lives as people who become ill don't shift to becoming solely focused on being a patient, but the medical institutions tend to look at the people who enter them primarily as patients, but people don't see themselves that way. And I think that causes a real rift in being able to communicate, being able to understand one another. I mean, I am a mother, I'm a daughter, I'm a wife, I'm a scholar, I'm a theologian, I'm a lot of things. I have a dog. Like, these are things that are important. And if I'm sick, yes, I've come to get help with my illness as a patient, but that's not my primary identity. And I think medical humanities acknowledges all these other facets of life because people's lives are complex and they're very beautiful. And we can quickly miss the beauty of life when we box it off as a diagnosis, a treatment, a patient. These are too simplistic to really connect. And I think connecting is really important in the medical world.
I would agree with that and tag on that when I was thinking about this, the big word that came to my mind was really context. So all of the rich context around how people understand health and illness, what they bring to it as, themselves, but also from their social environment, their cultural environment, their heritage, their ways of understanding the world, of which ideas about health and illness and how you deal with illness are part of that. And so it's really that kind of enriching, thinking about what people are bringing into a medical experience or other kind of healing experience, right? What goes on all around, what might happen in what we think of as traditional or very Western oriented medical contexts.
So all very kind of enriching and holistic readings of what we're talking about today, medical humanities. And I would like to offer to that this notion that we are human beings first, right? At our core, we share a set of lived experiences by virtue of being in bodies, by virtue of having relationships with each other, and a rich inner life as well, that oftentimes we don't really have the space to attend to or to recognize. And medical humanities, therefore, I think is a space to do that. It's a disciplinary or interdisciplinary space to be able to connect, to use Dr. Davidson's term, to connect, right? To contextualize, as Dr. Singh said, and to create space for that which often doesn't have space, as Dr. Wilkins said, the spiritual self. And the medical field, I think, has begun to recognize that we aren't just corporeal beings, and we don't just have all of these various different roles in society, but that we, have these rich inner lives that are very much a part of how we show up to healing spaces as healthcare practitioners or as recipients of care. And much research, corroborates this notion that we are more than our diagnosis. We are more than kind of the tools and the education and credentials that we bring to our encounters with others. So I'm just really delighted to be here, looking at the chat and seeing that, everyone's excited for the discussion. And there are 81 of us, 81 people here together today. So I want to express my gratitude.
So just connecting to what Ulluminair said, Dr. Salim, I think when I think about skill of being doctor, I think I separate two things: the arts and science of medicine. And we tend to, when you're studying, of course, you focus on science because that's what you have to use. But you also need the art of medicine. How do you, build that skill? Sometimes you need beyond science. And how do you build trust? Sometimes patients don't respond or could even ignore the diagnosis because they don't trust someone. So not only have to, diagnose someone, but also have to trust someone. So if you imagine patient coming into hospital with all the anxiety and worries and pains, but imagine when they're exiting the hospital, they don't just take, bring back the pill, but the whole experience for the hospital. I think that whole experience, have to be also think about, not just what you give, just the numbers and medicine, chemical numbers. So I think those are the medical humanities focus, the whole experience of being, with medicine.
Ayub, you're muted.
Muted, yeah.
Oh, that explains it. Well, thank you guys so much for your first responses to this question. And, kind of echoing what Dr. Ulluminair Salim said, thankfully, thanks to you guys as speakers, as well as all the participants. And I also want to remind you guys, in addition to the 83 participants here, we also have the live stream on YouTube. So who knows, we might have even reached 100. So once again, thank you guys all, and hopefully you guys really enjoy this conversation as we delve more deeper into it. So for the second question, It's going to be what led you towards the field of medical humanities?
Okay.
So feel free. Yeah.
Everyone's like, we're all looking at each other, I guess. It's hard to tell on a screen, right? You just look into the camera like, I'm looking at you. Why aren't you going? But, I would say that what led me here was nothing of my own making, but instead my own life experience. So when I was pregnant with my first child, I had a lot of medical interactions because my pregnancy was very troubled. I ended up being a patient in the hospital for 7 weeks before my son was born. He was in a neonatal intensive care unit for 4.5 months after that. So we spent 6 months of a year decidedly in an institution every day, all day, constantly. And so I became quickly immersed and educated in what it meant to be a patient and a caregiver of a patient. And I was able to navigate that space, having at that point in my life already earned a master's degree. But I also came into contact with a lot of other different people who were navigating that space with much fewer resources than I had. I was struggling, but there were many people who I felt were despairing because of the challenges that the medical institution was putting up inadvertently oftentimes. I don't think that the barriers that we have in medicine are necessarily barriers that are constructed purposefully, but inadvertently keep people from being able to have the support and the resources that they need in order to navigate that space. And so I began to identify many of these problems. And at this point in my life, I had a bachelor's degree in communication and I had a master's of divinity, and I hadn't taken a science class since my 3rd year of college. And so I wasn't really equipped to go into any kind of medical practice, but I could see the problems. They were very clear to me, really from a communication standpoint, oftentimes, that there were all these communication gaps. And I thought somebody should really do something about this. And so as I began to continue on, my son came out of the hospital. He still had lots of medical issues. So I continued to engage in that space. And then many years later, I came into contact with the development of a pediatric palliative care team. And I didn't know what that was. And when I started learning, I learned that there was a chaplain on that team. Well, that was a degree I had, and I could relate to that level of that kind of training. And I thought, oh, well, what is this chaplain doing on this medical team? And then I learned that there were physical therapists and child life specialists and all these different people besides a doctor and a nurse. And so I thought, oh, wait a second, this is an area where medicine is pulling together a more humanistic approach to people, looking at people in their whole life, supporting not just patients, but their families as well, and engaging people outside of the hard sciences in order to help support people. And so I just became enlivened to what was possible. And even at that point, I would not have been able to use the term medical humanities, but like many of us, I just started on a path because this was the place that I knew to go. And I took one step and then I took the next step. And along that path, eventually, I learned of this field called medical humanities. And I thought, oh yeah, that's what I've been doing. That's what I'm excited about. That's what I'm interested in. That's what I want to learn more about. And so it wasn't something that I formulated at age 18 and went on a path towards. It was something that, seeded in me as a 30-something-year-old and has grown up over time. And I still am learning about and still am growing in.
Dr. Wilkins, were you going to share next?
No, I was going to invite Professor Sakai to do so. Just thinking maybe we would go in reverse order or something from last question.
Perfect.
Mine is pretty different than others because I'm actually a trained practice as an architect. So I recently heard the medical humanity in 2016 when I came to USF. And so what's nice about the environment to Judy Gamseth Honors College is that it's an interdisciplinary place. So you can bump into any ideas. So, you know, that was the first time I heard about. But what I was interesting was actually neuroscience and architecture. It's a new field, relatively new field, that how the environment affects patient, for example. And I always liked the neuroscience. I was excited to learn about brains. So I was very excited about the topic. And then, you know, the difficulty when I went to the first conference was how do you even describe a human experience of space or architecture? And that's when it gets ding, and like, oh, the medical humanities is something we can connect with, you know, how we experience. It's not just a molecule that's sensing this, it's a whole senses, right? You have to use. So, but how do you even describe? And when you start talking about describe the space, now it's going to more philosophy of ideas, right? How do you actually define a space to even express in a space? So those are the area that I start connecting that, and that became my area of medical humanities. That's kind of how I started. Well, maybe Ulluminair, I can throw a ball to you.
Beautiful. So Professor Sakai is referencing something that we do at the Judy Gamseth Honors College in some of our classes. We have a hacky sack. We have, you know, a variety of different tools that we use to infuse serious play into our classrooms. So I wholeheartedly accept that symbolic hacky sack, Professor Sakai. So medical humanities for me emerged during a course that I was teaching in San Francisco, California, in which I chanced upon Dr. Heather Dewey Hagborg's work at the interface of science, art, and social justice. And I became fascinated by the ways in which we can use the arts as tools, as communicative tools, as tools for healing, as tools to enact justice, and to speak across cultures and express kind of the depth of our emotion beyond words. So Dr. Hagborg's work harnessed the power of DNA technology to create 3D renderings of, you know, subjects people who had just left various different materials on the streets, you know, discarded cigarette butt, coffee cup, and she developed these 3D renderings as an intervention upon you know, our privacy, right, and our genetic privacy, and kind of who has dominion over, you know, the body politic. And so I became inspired, and I wanted to bring tools like that, tools to think with like that, to my classroom, to my advocacy and activist work. And so for me, there's a layer in the medical humanities that's decidedly justice oriented and harnesses the social sciences to be able to recognize that the practice of medicine is a humanistic endeavor, but it also, as is in my purview, every endeavor we, you know, take up as human beings, a very political endeavor. So I then kind of pursued further inquiry into the ways in which the arts can be a tool to bring voice to those who are silent or silenced. So that's a bit of my entree. I will pass the baton then to Dr. Singh.
Thank you. Well, one part of my experience with this is that all of us are teachers. We all facilitate conversations among our students. And sometimes we even turn the teaching over to the students. And when we do that, I find it very useful to teach them about getting used to crickets. That is just, waiting out the silence and waiting for somebody to pick up that baton, and they almost always will. But, that's one way that we go about it. And there are lots of others too. I love the hacky sack or the ball, or had beach balls used in my class before to do that. For me, I think too, this was kind of a meandering path to something called medical humanities. And I would still say that that's kind of one of the hats that I could wear among others. And I think that's part of my own sort of interdisciplinary training from the get-go as a person who went to a liberal arts college, got to study lots of different subjects along the way and kind of feel out the things that I was interested in. I also was not on one single committed path from the age of 18 onward, but kind of exploring the world is what I was really, most interested in. And along the way, that ended up taking me different places in the world that I hadn't imagined before. And, I had never imagined when I was in high school or when I started college that I would end up spending a semester in India as part of my studies. And I never imagined either that I would make a career out of studying cross-cultural experiences of life, the world, health, illness. Or that I'd go back to India, that I would learn Indian languages, learn to do research in those languages, learn to teach about those kinds of cross-cultural encounters and different ways of structuring the world, understanding the world. But I knew that always I was interested in people's creative production, people's ways, the creativity that goes into what seem like things that we take for granted all the time, right? Like who we understand as part of our family and how we categorize those people as family and how we categorize other people as not family, right? And there's so many ways we can spin that out. We can see how different people in different parts of the world in different periods of time, construct very different worlds out of a simple kind of thing like who's in your family, right? And so when we get to something like health and illness, then it's like, okay, so how do people understand what makes a person healthy? What makes a person ill? What do you do when a person is ill? Who should be involved when a person is ill, right? It starts you down a path of thinking about all kinds of questions, right? How do we look beyond the confines of what we take for granted, what we take as the everyday? So actually got me thinking when Professor Sakai was talking, thinking about, something like the built environment of a hospital, and how as an anthropologist and a medical humanities scholar, I would start thinking about, that kind of, what does this look like to someone who's an outsider to the space? What does it look like to someone who's an insider in the space, right? How does the organization of space tell us things about how the place works, what it means, how people are valued within it, which could be really detailed things like I did my advanced studies at the University of Virginia, and we would talk in my classes a lot about things that happened in Virginia, and learning along the way that there were periods of time when the hospital spaces were segregated, right? And spaces for people of one race were in this part of the hospital, and spaces for people of other races were in a different part of the hospital, maybe on a different floor, maybe in the basement. What does that tell us about how that space was organized and how people's lives were seen in those eras and in those spaces? So I guess really it was curiosity that brought me into thinking about medical humanities kinds of questions, but intersecting with a kind of broad appreciation about the diversity of human lives and ways of being in the world.
I can kind of pick up where you left off there, Dr. Singh. Like many of my colleagues, my engagement with the medical humanities was organic. It wasn't something that was preordained. I'm trained as a cultural historian, and so I've always been interested in the ways in which the humanities, that is art, literature, music, dance, both reflect and shape our worldview, socially, politically, spiritually, and represent the human experience. And kind of thinking about speaking with you all today, I was thinking back on my academic career, and as an undergrad, I wrote my thesis on Albert Camus' The Plague, right? This French existentialist philosopher's fictional work, The Plague. And then my master's thesis was on the artist Paul Gauguin, and I was interested in the way in which his late stage syphilis impacted his art production and life in Tahiti. So I guess I've always been kind of curious about the ways in which medical topics or themes like pandemics and plagues and venereal disease has made an impact on art and literature. But it wasn't really until the last 5 years or so that I began participating in what I would consider a very rigorous engagement with the medical humanities through a collaboration between the University of South Florida and the Tampa Museum of Art. And I'm just going to share my screen really quickly, if that's okay with you, Ayub, to show a couple of photographs of my students at work delivering something we call the Connections Program, where we provide therapeutic interactions with art for a range of different patient participant groups and their caregivers. We started out looking at research that existed that illustrated the ways in which certain types of engagement with art were beneficial for people with Alzheimer's disease in terms of reducing stress and improving mood, and in some cases, improving cognition and communication abilities, at least in the short term. And from that point, we started developing programming for folks with Alzheimer's, and we have expanded to begin applying these methods and some others that we've been experimenting with to a range of different participants, including people with PTSD, folks with HIV/AIDS. We also partner with a substance use disorder treatment facility to deliver therapeutic programming around the visual arts. And that is where as I said, my engagement with medical humanities really deepened at that point. And as you mentioned in my bio, I now deliver medical humanities curriculum for the Doctoring 1 students at the Morsani College of Medicine at USF. And several of my colleagues here joined me in delivering the curriculum for the students in their second year of med school. And that's given me some new insight into the ways in which their particular training intersects with my training as a humanities scholar.
All right, thank you everybody for your wonderful responses. So now that we understand what medical humanities are and kind of how you guys or how everybody kind of got into the field, I guess the next question will be, how does the medical humanities approach work with the community and local healthcare? So kind of like, what's the intersectionality between medical humanities and healthcare?
So I would be happy to begin this discussion and in it share a little bit of the context of kind of who I am and where I'm from. I gave a very succinct response before that really didn't give you a glimpse into my world and why I have the commitments that I do. So I am a native of the San Francisco Bay Area in California. And as an undergrad, I pursued social welfare and amongst many other majors, pretty much every major I could declare. And I had, this enduring affinity for kind of serving people on the margins, right? Those who folks might pass on the street and turn the other way because they were dirty or otherwise intimidating or frightening in some way. Those were the people that as a young person I leaned toward. And that kind of spirit of togetherness kind of persisted as I reached an impasse. I at one point was going to pursue a career in medicine. And much like Dr. Davidson, kind of the divine providence kind of ushered me in a different direction, as often life does. And I decided to pursue a Master of Public Health degree. So I spent a year in Maryland, Baltimore, Maryland, where I observed poverty unlike I'd seen before. And also experienced the kind of symbolic and very real spatial segregation between institutions and well-regarded institutions in the United States, like the Johns Hopkins Bloomberg School of Public Health and the Johns Hopkins medical institutions in particular, and the predominantly poor African-American East Baltimore residents who were our neighbors. And so for me, medical humanities, as we are theorizing it and operationalizing it here in this discussion today, really manifested in the types of conversations, the types of crossings, kind of symbolic or otherwise, the permeability of the boundaries, right? Many times I wondered, why aren't more East Baltimore residents inside the Johns Hopkins Bloomberg School of Public Health? Why are we not having conversations and partnering with these communities? Instead, I saw signage for, why we shouldn't consume, a 12-ounce soda because it's bad for our health. And by golly, we need to run X number of minutes to burn those calories when there are people who are dying on the streets. There was just this profound disconnect I witnessed in kind of the traditional public health paradigm that really kind of inspired me to search for alternative approaches, theories about kind of why social inequality exists. Right, so then I pursued a PhD in sociology and began to see the ways in which, through community partnership, service, community-based participatory research, photo voice, which is just a really powerful modality that recognizes that people who are experiencing phenomena on the ground are experts, right? That they have this profound knowledge that they can bring to, academic spaces, that they can bring to public health departments and hospitals and clinics, that they have a wisdom, that they have, this expertise, right, that transcends education, formal education. So to your question, Ayub, about one of the ways in which I have seen medical humanities manifest at the interface between community and the institution was a course that I taught at Johns Hopkins called Disease Detectives. We had this really beautiful, and I say beautiful in the sense that I recognize how powerful and inspiring it was, but it was anything but beautiful in its kind of the meat of what we were kind of grappling with and sinking our proverbial teeth into. It was a toxic tour with Mr. Glenn Ross, who was a longtime community member in East Baltimore. And we boarded a big yellow bus, my students and I, and we actually took a tour through the back roads of East Baltimore. And Mr. Ross just gave us so much kind of wisdom and history about environmental racism, right? And he didn't necessarily call it that, you know, but he knew the history, he knew the dates, he knew the names, he knew the rich narratives and stories that peopled the vacant streets and the abandoned brownfields and the, you know, boarded windows that we passed by. And that was just a profound education for me about the power of the humanities, the arts, cultivating the capacity to see, being able to create community and foster dialogue and deep listening, right? That really kind of enriched what we were trying to achieve as a course, as a community, and as an institution that is trying to partner or at least kind of repair some of the trauma that it inflicted upon African American community. So that's an example that I'd like to bring to this discussion. Thank you.
Just to let you guys know, since we are kind of running a little bit out of time, kind of what I thought we could maybe do is some of the questions that have been asked, they've been receiving a lot of upvotes, and they did relate to our last question that we had in plan. So if you guys don't mind, we could just continue on with getting as many questions from the audience answered. So sorry about that, but hopefully, you know, we'll still have a very enlightening conversation. So for the first one, you know, anyone can answer. It says, I thoroughly enjoy taking medical humanities classes. What interesting topics do you find most interesting and beneficial to someone hoping to go to medical school?
So I will be teaching a class starting on Monday called Narrative Medicine in the Judy Genshaft Honors College. And I love this class because it is about the story. And when a patient comes into a medical setting, a clinical setting, what a doctor is taught to do is, and I quote, take their history. And that sounds really violent, to take someone's history, because what is happening in many times is that the patient is laying out their story about what has happened to them. And what a physician is being trained to do is to cue off of certain pieces of that and to put it down in a list of symptoms or potentially causes of the problems that the patient is having, so that they can then take that list of symptoms and begin to discern what the good treatments would be for those symptoms and for the problems, so that they can diagnose and so that they can treat. And it is incredibly efficient, but it can feel violent to a patient. And so what narrative medicine does is it rolls that back, and instead of taking someone's history, it says, listen to the story. There's a story here. And the story that someone is telling may at first blush seem really not related to why they are there in the first place. They may have a broken leg and they are telling a story about what they had for breakfast that morning, and they don't seem to be related. But with just a little bit more listening, a lot of times we can begin to have a greater understanding for people when we know more about their story, as opposed to just trying to come in and grab the list out of it. To take the history is to take the list out, but to stop listening to the actual story. So narrative medicine, I think, is a great way for people who are going to become physicians to kind of get the red flag warning. Look, this is how you're going to be trained in medical school and in your residency to do these things. And those lists are efficient and important. And no one has time to sit and listen to a 2-hour story if someone is having a heart attack or, you know, suffering some sort of acute problem. We need that efficiency, but we also need the humanity of listening. And so I feel like that is one really helpful way to train yourself into being this more holistic physician. And I do not pretend to say that this will be an easy thing to do. This is an uphill climb for anyone who wants to go into medicine, to maintain these worlds which have these artificial barriers in between them, because so many people want it to be neat and boxy because that is efficient. But the reality is that people just aren't efficient. And so when we go into medicine, we're going to take too much time. We're going to say too many words. We're going to be more complicated. We're going to disclose things at the very last possible moment that should have been told at the very beginning of the consultation if we wanted to go with the efficiency, goals of the institution. But we're people with stories, because at the end of the day, when that patient leaves your encounter, they're going to call a family member, going to go home and talk to a roommate, or they're going to put up on their Instagram story what happened. And it's not going to be a list, it's going to be a story. And so knowing how to story and understanding the navigation between those things, I think is really important. So if you can take a class on narrative medicine, or just read books on narrative medicine, or read stories about patients, those are really exciting ways to kind of build that up in yourself.
Thank you so much, Dr. Davidson. So, as she said, narrative medicine is definitely something that she would highly recommend. Next question we have here is, what changes do you think med schools should make to better incorporate medical humanities in their training? Kind of a big question.
Well, yeah, and I think it's a question of time too. As Dr. Davidson said, we know that medical institutions today are pressing everyone for their time, and that happens during your training in med school too, when you will be completely overwhelmed and have no time for a life outside of school. So trying to fit medical humanities into that rigorous curriculum is sometimes challenging, but our top medical schools in the US have found a way. Look at Harvard or Yale or Columbia, they're doing it. And I think that if I could just share my screen again super briefly, there is compelling evidence to demonstrate why it is important to include the medical humanities. There's lots of research on how it helps with so-called soft skills, like interpersonal communication and building empathy. But these are also core competencies for people who are training to be physicians. You're going to need to demonstrate that you can self-reflect and that you can communicate well with others. And there is evidence that shows the medical humanities helps with that, as well as getting back to something Dr. Salim had brought up at a couple of points in her sharing with us earlier, that the medical humanities can help us address some of the systematic problems and injustices that medicine perpetuates and has perpetuated historically. I love the research that shows how it can disrupt someone's perceptions and assumptions about the field that they're going into. So again, kind of going back to the last question about topics in medical humanities that are interesting, I would encourage you to look at history of medicine as well, as something that illustrates how this field is always evolving and changing and fixed. Like science, it is something that is meant to be tested and changed over time.
Thank you so much, Dr. Wilkins. So we have about 5 more minutes, so hopefully we'll get through as many more questions as we can. The next question, I kind of combined them from the Q&A, but basically we have 2 students here that are interested in, does medical humanities include health diplomacy? Diplomacy as well as anthropology?
So I might speak to this one a little bit. So when we think of medical humanities, it's often not something that students major in as undergraduates. It's often something that they take up as an interdisciplinary pursuit along with their major, or maybe they're, a pre-health major or something like that. And they include medical humanities as a kind of separate field of study. And oftentimes medical humanities is comprised of courses from many different disciplines or interdisciplinary courses. So you might find courses from psychology, sociology, women's gender and sexuality studies, anthropology, art, art history, communication, right? Physics sometimes, like history of science. There's so many different courses that could be medical humanities based. It really depends on the approach of the person who's teaching it and the audience that they are engaging with. And so sometimes, several of us engage with medical students, right? We bring particular topics to them. For me, they're often topics about cross-cultural kinds of issues that may have to do with injustices, may have to do with things like issues of language and cross-cultural communication and power and gender, right? And so in some ways, medical humanities is not necessarily something you major in, but it's a kind of grounding that can become a foundation toward a profession that might be advanced training in the discipline, but could be part of your pathway toward becoming a physician or a public health specialist or a nurse or other allied health professions. And so it's really, I think, about getting some of those core kind of orientations. Like what I think about is kinds of things like learning how to listen, learning how to notice, learning how to ask good questions. And some of that's about, are people looking at me? Do they seem scared? Do they seem ready to engage? Are they hesitant to ask a question? Then I learn to draw them out. Do I learn to change the situation so the power dynamics aren't so stark, right? So it's that kind of thing of like learning these basic sorts of orientations, or, sometimes maybe, when am I talking too much? And I just need to be quiet and hear what this person in front of me has to say, right? So I think definitely anthropology, other social sciences can be part of that. And there are specialized subfields within disciplines that are oriented toward the medical humanities as well. But I feel like it's not an all or nothing kind of thing.
Thank you so much. All right. I think we could get through 2 more questions.
I'm sorry.
Or
There was
yep.
a part about health diplomacy, and I think this
There
is
was, yeah.
important to touch on because everybody may not want to be a doctor. I don't think everyone should be a doctor. I think we should have lots of different people interested in health and wellness in our world and in our society. And we should have some really great doctors, and we should have some really great other people who are also interested, because what we can't do is create an interdisciplinary team if everyone's in the same discipline. So we need lots of different disciplines investing in this area. And I think the area of health diplomacy is really interesting because we need people making good policies who have an idea about what it is like in the health world. And so we need people who can cross these boundaries and be aware of multiple spaces in order to create good policies, in order to have excellent relationships with other countries and other people from across the world. And so I'll give you an example of how many different possible ways you could get there. So I had a student who just graduated. He has a degree in chemistry and music. Okay, so he double majored in chemistry and music. He did an internship in Washington, D.C. with an organization that was lobbying for better end-of-life care, advanced care planning kind of organization. And now he's entering an MD PhD program where he'll focus on palliative care. And he'll become a physician, but he'll also have a PhD. He is well suited to enter a field of health diplomacy, but he would not have to go the MD route to do that at all. He could have decided to go to law school instead. He could have decided to continue his path of music, but also, engage in some other opportunities where he makes connections and networks with people who are interested in the same kinds of things. So there is no one path to get to these places, but I think what you do have to do is show up to these conversations, become aware of opportunities, maybe to study things as a minor or take some classes in different areas to begin to help yourself understand and see yourself as a lifelong learner, that you're not going to go to school, get this degree and then know it. You're going to continue, just like each of us, to grow and to learn and to go, oh, that's over there, I didn't even know about that as a possibility, and move in that direction. And so be encouraged. Nobody's got it figured out right now. But there are many ways you can be involved that are not locked into 4 years of medical school, followed by residency, followed by, all of that. So you have a lot of options in terms of entering this area. Think of it as like a playground, not as an assembly line.
Thank you so much, Dr. Davidson. All right, and with that, I believe it is 2:51, so our session is practically done. But if any of you guys have any closing remarks or anything you would like to quickly add, feel free to do so at this time.
I think I'm just going to add to the Dr. Davidson. Quite often that I notice people don't become architect in general, especially in the medical field, but you live in the hospital, a lot of issues are for example, burnout for the physician. If you are in a situation, what would you do? One thing you could do is you can take a pill, but also you can change the environment. And you're talking about greenery, for example, the water, color, those things affect. So you don't need to be architect, but you can incorporate into your life. So that's what this is all about. I think that's what I wanted to add to the final. Thanks.
Thanks for doing such a great job on this conference generally, and we appreciate being hosted for this session.
Yeah, of course. Thank you guys. And as based off the chat and everything, I think a lot of people really did enjoy it. We had about 120 plus students attending. So thank you guys so much. I hope everyone in the participants really learned something today. And make sure to continue on with the rest of the conference. It continues on for the next 2 days. So yeah, thank you guys again.
Thank you, everyone, and continue to take care of yourselves and each other during this time. That can manifest in various different ways. It could look like, deep breathing, sitting in silence, doodling, dancing, listening to your favorite music, going for a walk. Recognize that as you prepare to be healers or do, groundbreaking scientific research, that you too are, a human being, and that you too likely need care, as do we all. So I just want to offer that in the spirit of what we've brought to share with you today, to be kind to yourself and others during the times ahead.
Absolutely.
All right. Thank you so much for joining us. We will transition into our next session. Ayub, if you could transition me to host, please. And I will go ahead and share my screen. Our next session is Miss Shavona L. Wynn. She's a master's in education, and she's the director of Johns Hopkins Underrepresented in Medical Professions at Johns Hopkins University. She is, give me one moment, please. We will go ahead and introduce her in a couple of minutes. We do have about 5 minutes until 3:00 p.m. Eastern time. So stay tuned, get up, take a short break, move around, take your eyes off the screen, eat a snack. We'll be back soon.